Hi there, this is Nurse Sandy, and I'm here today to tell you about iron deficiency anemia. What is iron deficiency anemia? Well, it's a condition in which your body is low in iron. When your body does not have enough iron, it will make fewer red blood cells, like in this picture, or the red blood cells will be very small. Anemia caused by an inadequate supply of dietary iron is the most prevalent nutritional disorder in the United States and the most common mineral disturbance. Some of you might be familiar with the Women's, Infants, and Children program called WIC. This program provides iron-fortified formula for the first year of life and routine screening of hemoglobin levels during early childhood. This program has done a lot to decrease the prevalence of iron deficiency anemia. During the last trimester of pregnancy, iron is transferred from mother to fetus. Most of the iron is stored in the circulating erythrocytes of the fetus, with the remainder stored in the fetal liver, spleen, and bone marrow. These iron stores are usually adequate for the first 5 to 6 months in a full-term infant, but for only 2 to 3 months in preterm infants or multiple births. Physiologic anemia should not be confused with iron deficiency anemia resulting from nutritional causes. Although most toddlers with iron deficiency anemia are underweight, many infants are overweight because of excessive milk ingestion. These babies are known as milk babies. These babies become anemic for two reasons. Milk, which is a poor source of iron, is given almost to the exclusion of solid foods, and 50% of iron deficient infants fed cow's milk have an increased fecal loss of blood. After the diagnosis of iron deficiency anemia is made, therapeutic management focuses on increasing the amount of supplemental iron the child receives. This is usually done through dietary counseling and the administration of oral iron supplements. In formula-fed infants, the most convenient and best sources of supplemental iron are iron-fortified commercial formulas and iron-fortified infant cereals. Look at that baby chow down. Infants younger than 12 months of age should not be given fresh cow's milk. This may increase the risk of GI blood loss occurring from allergy to the milk protein or from GI mucosal damage resulting from a lack of cytochrome iron. The prognosis for a child with this condition is very good. However, there is some evidence that if the iron deficiency anemia is severe and long-standing, cognitive, behavioral, and motor impairment may result. An essential nursing responsibility is instructing parents in the administration of iron. Oral iron should be given as prescribed in 2 divided doses between meals. It is given between meals because that is when the presence of free hydraulic acid is greatest, since more iron is absorbed in the acidic environment of the upper GI tract. A citrus fruit or juice taken with the medication aids in absorption. You can tell your parents this. Here's a nursing tip. Cow's milk contains substances that bind the iron and interfere with absorption. Iron supplements should not be administered with milk or milk products. An adequate dosage of iron will turn stools a tarry green color. You might want to educate your parents about this so they don't faint if they see this and think it's wrong. Educate your parents that it's actually a good sign, because the absence of this greenish-black stool may be a clue to poor administration of the iron, either in schedule or in dosage. In that case, a little more education might be needed. Also teach them that if their child is receiving a liquid form of iron, it may temporarily stain the teeth. If possible, the medication should be taken through a straw or given through a syringe or medicine dropper placed towards the back of the mouth. Brushing the teeth after administration of the drug also lessens the discoloration. Okay, let's go over the nursing objectives and then we're all done. A primary nursing objective is to prevent nutritional anemia through family education. Because breast milk is a poor source of iron after 5 months of lactation, the nurse must reinforce the importance of administering iron supplementation to the exclusively breastfed infant by 6 months of age. However, the American Academy of Pediatrics recommends preterm and low birth weight infants or infants with inadequate iron stores at birth receive iron supplements before 6 months of age. In the formula-fed infant, the nurse discusses with parents the importance of using iron-fortified formulas and introducing iron-rich solid foods at the appropriate age, such as iron-fortified cereals. Again, when it's age appropriate, here are some examples of some iron-rich foods. One thing I wanted to talk about that we didn't mention before was adolescents. Adolescents are also at risk because of their rapid growth rate combined with poor eating habits. Diet education of teenagers is especially difficult, especially because teenage girls are particularly prone to following weight reduction diets. Okay guys, that's it on iron deficiency anemia. Thanks for listening.